Hey, welcome to UroPatient, where we break down urology topics in a clear, simple, and patient-focused way. In today's episode, we're diving into a condition that affects millions every year, kidney stones. If you ever had one, you know the pain that can be intense. But understanding why they form, how to prevent them, and what treatment options exist can make all the difference. So today we'll walk you through the basics, what kidney stones are, the different types, the common symptoms, and most importantly, when to seek help. And some lifestyle changes that can significantly lower your risk. My goal is to help you feel informed, prepared, and confident in managing your kidney health. So let's get started with kidney stones, what you should know. I'm going to be covering these 6 areas. Kidney stone basics. I'm going to be covering these 5 areas. Kidney stone basics. Number 1. Kidney stones form when certain minerals and chemicals in the urine become too concentrated and start to crystallize. Did you ever do those experiments when you were a kid with the rock candy? You know, you took sugar and you got it real super concentrated by heating it up, and then you put a string in there and it formed a crystal. Same thing in the urine. So as urine becomes more saturated, often due to dehydration, low water, high salt intake, or excess stone-forming substances like calcium, oxalate, or uric acid, tiny crystals begin to develop, just like that rock candy. These crystals can stick together, gradually growing into a larger stone within the kidney's collecting system. If the stone becomes large enough, it may actually fall and move into the ureter, where it can block the urine flow and cause severe pain in the kidney stones that kidney stones are only all too well known for. Number 2, let's talk about those symptoms. The symptoms of a kidney stone often come on suddenly and can be intensely painful, typically beginning with sharp, cramping pain in the back or side that may radiate to the lower abdomen or groin as the stone moves through the ureter. One of the tests that we check for a kidney stone is we'll take our hand and we'll tap on your back, right where you see that red spot. And if a patient's got a kidney stone, you're going to jump. Now, we don't do it because it's fun to do. I mean, it's a symptom a test for kidney stones. Many patients also experience nausea, vomiting, and an urgent or frequent need to urinate, sometimes accompanied by a burning sensation. Blood in the urine is also common, giving it a pink, red, or brown tint. Brown would be its older blood. And some people may notice cloudy or even foul-smelling urine. Now, when should you seek immediate attention? Well, you should seek immediate care for a kidney stone if you're experiencing severe, unrelenting pain that prevents you from sitting still or finding a comfortable position. This pain is no joke, folks. It's the worst, as they may indicate the stone is blocking the urinary tract. Urgent care is also necessary if you develop fever, over 100 degrees usually is our thing for Fahrenheit, chills, or just generally don't feel well, as these can also be signs of a dangerous infection behind an obstruction. That's the real problem with kidney stones. You block the kidney, get an infection, you got that blockage, it can go into something very dangerous. Additionally, seek prompt evaluation if you notice difficulty urinating, blood in the urine, persistent nausea or vomiting that prevents you from hydrating, or if you've had a history of kidney stones in the past. Or if you only have one functioning kidney. Sometimes you've had an accident, one kidney was removed, you had cancer, a kidney was removed. You only got one kidney. You can't take any chances on that. Early medical attention helps prevent complications and ensures you receive the right treatment quickly. Now, your diagnosis journey. Number 3. Here's what you should expect. Diagnosing kidney stones typically begins with a healthcare provider reviewing your symptoms and performing physical exam, like I told you about that tap on the back, followed by imaging tests to confirm the presence, size, and location of the stone. The most common and most accurate test is a non-contrast CAT scan, which can detect even very tiny stones. Ultrasound is often used as a radiation-free option, so that might be somebody who's pregnant or somebody who's had to have a lot of imaging studies where we're worried more now about some of the X-ray exposure. And CAT scan is one of the worst. In some cases, an X-ray called a KUB, which stands for kidney, ureter, and bladder, but it's a one-shot X-ray, may help track stones that contain calcium. It won't see stones that have other crystals like uric acid, which will show up on a CAT scan. Your provider may also order urinalysis to check for blood, infection, or crystals, and blood tests to evaluate kidney function, measure minerals that contribute to stone formation. Together, you put all the stuff together, and this helps guide treatment and relief and prevention. So what does that image stand for? How do you decode it? So decoding it can sometimes feel overwhelming, but understanding a few key terms makes it much easier. The reports typically going to talk about the size of your stone, and as you can see, under 5 millimeters, high chance that you could just pass it on your own. Over 5 millimeters, high chance that you're coming in to have surgery. So that's why it's important. Now, stones are measured in millimeters, and smaller stones pass on their own. Larger ones need medical intervention, as I mentioned earlier. The location, whether the stone is in the kidney, up high, in the ureter, the tube coming down, or near the bladder, that helps explain your symptoms and determines how urgent treatment may be. So if it's up in the kidney, it's got a long way to come down. If it's down by your bladder, you might be home free in no time. Your report may also note whether the stone is causing obstruction. Hydronephrosis, that's a term they throw out there, means swelling of the kidney, water and kidney swelling, or signs of infection. By breaking down the details, your provider can guide you through what your findings mean and the next steps that you need. So, talk about next steps. What are your treatment options? Conservative management often focuses on helping kidney stones pass naturally while managing pain and preventing complications. As I mentioned, most small stones, typically under 5 millimeters, can pass on their own with supportive care, which includes drinking plenty of fluids. Yeah, that's to help push it down and increase the urine flow and keep that stone a-moving. Pain is managed by medications like what we call NSAIDs, non-steroidal anti-inflammatories like your Motrin and things like that. And in some cases, we may put you on something called an alpha blocker, like tamsulosin. Now, tamsulosin is used to treat prostates. It helps to relax the muscles around the prostate, making it easier for a guy with a big prostate to urinate. However, what they found is people that were on tamsulosin also pass stones easier. It relaxes the ureter a bit, so causing it to speed passage. Now, patients are advised to stay active, monitor their urine and stone fragments, and watch for warning signs like fever and vomiting. Now, how do you monitor for stone fragments? We're going to probably send you home with a strainer, just a funnel with the strainer in the bottom. You should be peeing through that. I always tell patients also, when you see something in there, like you may pass some clots which are going to be soft, and you might think that's the stone. This may sound gross, but touch it with your finger. Push on it. If it should feel like sand. If it feels soft, it's a clot. If it feels like sand, you may have, bingo, passed your stone. We're also advised patients to conservatively manage their pain with, as I mentioned, those things like non-steroidal anti-inflammatories. Now, what happens if it's too big and it's not moving, or persistent pain or infection? How are we going to treat this? Well, the most common option is, when it's depending on where it's at, is to do something like a shockwave lithotripsy. That's a machine where you sit in lay on a table with a bag of water, and shock waves go through the water. Your body's mostly water, goes through that, and it's aimed at the stone and causes it to break into powder. The powder is much easier to pass than a big stone. But that doesn't always work. Sometimes it gets stuck in the ureter, as we see in that middle one. And then we use something called ureteroscopy. So that's a scope that we can place all the way up, in a skinny scope that goes all the way up into the ureter, and we can get right up to the stone. Sometimes we can grab it and pull it out. Sometimes we blast it with a laser beam to make it small enough to get it out. But we'll get it out. For very large or complex stones, we sometimes have to resort to going from the kidney side. And then it's something called a percutaneous nephrolithotomy, PCNL for short, which is a small incision, placing a scope through the kidney itself and going in that way and grabbing stones. So that's kind of a last resort. We usually don't do that too often, but it can happen. All right, now that we tackled the pain and the procedures, let's talk about how do you prevent this, because nobody wants to throw a party for a kidney stone twice. Staying well hydrated is one of the simplest, most effective ways to prevent kidney stones. Drinking enough water to help dilute the minerals and salts in urine that can form stones, making it harder for crystals to clump together. For most adults, aim at least 8 to 10 glasses of water a day. We always tell patients that have made kidney stones, don't pass up a water fountain without taking a drink. So, and another way to kind of gauge it is look at your color of your urine. You know, if your urine's dark yellow, you're not drinking enough. You want it to be a very light, almost clear. That's a good target. So do that. And kind of keep an eye on what your conditions are, the climate and stuff. If you live in Florida and it's hot, you're losing a lot of water without your knowing it by sweating. If you're someplace that it's not so hot, you may not lose as much. So keep that in mind. If you're more active, you're going to sweat more. Proper hydration not only supports kidney health, but also flushes out small stones before they can grow and reduces urinary tract irritation, keeping your overall urinary system functioning smoothly. Hey, here's a tip. Don't forget lemon. Lemon's a stone inhibitor. Add it to your water. Tastes good too. Now, speaking of things that you can do, your diet plays a powerful role in preventing kidney stones, and making thoughtful choices on your plate can significantly reduce your risk. Foods high in oxalate, spinach, nuts, some chocolates can contribute to calcium oxalate stones. Everybody always thinks about calcium oxalate, which is the most common stone, that if you take out the calcium, like drink less milk or something, it'll help. It's the oxalate, the other side, that causes a stone. So you got to get rid of the oxalates. Also, too much salt, animal protein can increase stone formation. Those are uric acids, are high in fatty in things. We always say anything that walks the earth is high protein. On the other hand, a diet rich in fruits, vegetables, and adequate calcium from foods like dairy can help balance urinary minerals and lower risk. Pairing proper hydration with mindful food choices turns every meal into an opportunity to protect your kidneys and keep stones from forming. I always say, first stone, you're going to probably do whatever you did before. Second stone, everybody gets religious. You'll start following what we tell you. Now, creating a long-term kidney stone prevention plan involves more than just surviving an episode. It's about protecting your kidneys for years to come. This plan typically combines consistent hydration, a balanced diet, regular physical activity, and routine medical check-ins to monitor risk factors and urinary health. For individuals prone to stones, your healthcare provider may recommend periodic urine and blood tests to track minerals and adjust your prevention strategies as needed. By making these habits part of your daily life, you reduce the likelihood of recurrence, improve overall kidney function, and gain peace of mind knowing you're actively managing your urinary health. Remember, you participate in all this. And that wraps it up for our deep dive into kidney stones. Remember, while stones may be small, their pain is mighty. But the right hydration, diet, and lifestyle tweaks, you can keep your kidney happy and stone-free. And you'll have a Merry Christmas that way. So stay healthy, stay hydrated, and may your only stones be the ones you skip in a peaceful lake. See y'all next week, and have a Merry Christmas.